I would like to call this meeting on the Committee of Health and Human Service Policy to order. There is a quorum present. May I have a motion to approve the minutes for Tuesday, March the 5th?
So moved.
So Representative Freiberg moved approval of the minutes for Tuesday, Tuesday, March the 5th. Any discussion? Hearing none. Those in favor say aye.
Aye.
Those opposed? The motion prevails and the minutes for Tuesday, March the 5th are approved. So we have two bills today before the body, and our first bill will be House File 273, Representative Schultz. Representative Schultz, would you like to move your bill?
Yes, I'd like to move 273, please.
Okay. So members, we have the bill before the committee. Okay. So Representative Schultz moved her bill to be re-referred to the Committee on Ways and Means. Representative Schultz, please present your bill.
Thank you, Madam Chair and members. House File 273 is a bill that will correct what is known as the family glitch. A few years ago, a healthcare finance task force was convened by Governor Dayton, and one of the recommendations was to fix this family glitch. And what do I mean by family glitch? Well, in the Affordable Care Act provisions, the affordability of health insurance was determined based on the individual premium price, and affordability was determined based on whether or not the health insurance premium costs more than 9.86% of an employee's household income. But it did not account for family coverage or coverage with dependents, which is, as you know, much more expensive than just an individual policy for one person. So this bill attempts to correct that family glitch, and it allows a spouse, an individual, to buy into the MinnesotaCare program, even if their spouse has employer coverage, if that coverage exceeds this 9.86% of household income based on the dependent coverage, the family coverage premium, rather than just an individual premium. So this is, I think, very good for individuals, and it's about, I think, almost 2,500 approximately individuals that would be allowed to buy into MinnesotaCare to fix this family glitch. It would make health insurance much more affordable for these groups of individuals, and address some of the problems people are facing in the market with high premiums.
All right. So thank you, Representative Schultz. We have a few testifiers who would like to testify on House File 273. The first being Paul from the Land Steward Project. Welcome to the committee. Please introduce yourself for the record and who you're with, and proceed with your testimony.
Thank you. My name is Paul Sobosinski. I work with the Land Stewardship Project. Our organization works on sustainable agriculture, what's good for the farmer, the community, and the environment. I'm also, besides working for the Land Stewardship Project, I'm a livestock farmer myself from Wabasso, Minnesota. For LSP, healthcare has a major effect on so many of our members. Affects their lives, their ability to grow their businesses, and it affects in terms of moving from one program to another. What I'd like to draw to your attention, which is in your members' packets, is a statement from Heidi Morlock, one of our members who couldn't be here today. And it's her story. And her story is how she's affected and how this bill could help. And in her words, and Heidi, just a little bit of background, is a person who has been a farmer, engaged in farming, looking at how to grow her income in terms of developing. She's going to school and getting an education degree. So before she took a job as a paraprofessional, She had health care with Health Partners by way of MinnesotaCare. Her husband covered her husband, Hans Nelson, and including Heidi. Her premium was $122 a month or $1,460 a year through MinnesotaCare. No deductibles, minimal co-pays. Had a young child, Simon, 14, who's on medical assistance. Their adjusted gross income is $44,000 in 2017. Total yearly health cost at MinnesotaCare was $1,464. After she took a job as a paraprofessional, while at the same time going to school to get an education degree, what she was offered was $500, cost her $595 a month through the school, or $7,151 a year. That includes the $2,700 deductible for her husband and for Heidi. Their son Nelson is on health insurance in another state for $1,000 a year. Simon is on medical assistance. Their adjusted gross income is $46,000. So when
Just a moment, please. For members who have not found the one-pager, it's in the HF3 packet.
So her annual take-home pay as a paraprofessional in Eastern Carbon County Schools is where she's employed, is $14,160. This isn't going to increase her AGI because Hans' gigs have decreased. Total yearly health insurance cost, because she took that job that offers health insurance, is in the range of $7,151 to $12,551, depending how much of the deductible they will pay. The grand total, somewhere in the neighborhood of $8,000 to $13,000 per year. Her husband deals with mental illness and has prescription drugs that include psychological visits. She now has a thyroid disorder. She has premium prescription drug costs, lab tests, doctor visits. They for sure will pay $10,000 a year in health insurance. More if something bad happens. And so if her adjusted gross income would increase to $50,000, for example, for 2019, paying $10,000 a year in health insurance is 20% of income. This is uninsurable for them, as unsustainable for them as a family. Her Hans is not eligible for subsidy for individual health insurance on the MinSure market, even though we qualify income-wise, she says, because my employer offered me health insurance. If she only had to insure herself through the school district, she would pay $1,460 a year plus the $2,700 deductible. The maximum out-of-pocket would be $4,116. By adding her husband Hans, adding a minimum of $5,735 a year, plus the $2,700 deductible for a maximum out-of-pocket of $8,435 a year. The whole point about this, just that small increase of income of $2,000 puts her in a huge cliff. Here we have a person who's been engaged in farming on her farm with her husband, raising crops, doing grazing with livestock, and looking at how they could improve their income and improve their family life, looking long-term down the road, going to school, education, and working, and the cliff is just unsustainable. And so that's why this particular issue needs to be addressed, and that's why we're in support of this bill, and we thank Representative Schultz for bringing it forward.
Thank you so much for your testimony. Next testifier is Kevin Brown, and after Kevin will be Bruce Miller. Welcome to the committee. Please introduce yourself for the record and who you're with, and proceed with your testimony.
Thank you, Madam Chair, members of the committee. My name is Kevin Brown. I'm the owner of Smart Set, Inc., a 33-year-old print shop located in Northeast Minneapolis. We are a certified B Corp, members of CWA Local 37002, and active in the Main Street Alliance and the Metro IBA. We provide health care insurance to our 5 employees and offer spousal and dependent benefits, but we cannot afford to provide any employer contribution for family benefits. We are not legally required to offer health care coverage. We do so because it's the right thing to do and because it's critical to hiring and retaining the best employees in a tight labor market. We continue to see costs and deductibles increase while benefits and access decrease. Current healthcare costs to the company amount to $3 for every employee hour worked. And healthcare for my family of 3 is over $25,000 a year, more than 25% of our household income. While this bill does not address the spiraling increases in healthcare costs overall, it does eliminate the family glitch, allowing spouses to qualify for subsidies. This is critical for small business owners who account for over 90% of all businesses in the state and over half the jobs. Household income can vary greatly across our workforce. Right now, some employees and potential employees rely on me to offer family coverage, but for others, my offering that eliminates much-needed MinnesotaCare benefits. Healthcare coverage is the #1 issue that prospective employees ask me about, even more than salary. There are many challenges facing small businesses, but all we're asking for is a level playing field. We will never be able to offer the same benefit packages as Target or 3M, but we can compete for skilled workers if people or their spouses are not penalized by working for a small business. I ask for your support of this common sense measure to eliminate the family glitch and base MinnesotaCare subsidies solely on an individual's income, regardless of their marital status. I hope it's a first step toward doing the same in MinSure plans as well. Thank you.
Thank you so much.
Good afternoon, Madam Chair. I'm Bruce Miller with the Minnesota Farmers Union. We're pleased to be here today in support of fixing this glitch. When I come back at another bill here a little later, you'll hear me talk about the crisis in healthcare costs in Minnesota, which we are facing on a daily basis. We already have significant pressure on family farmers across the state, many of whom are working off the farm for health insurance. And this is the kind of glitch fix that can help many of the farmers. You just heard about one in a couple of testimonies ago. That's just one of many, many, many. So we're here and thank you, Representative, for bringing this bill up to fix this, and Farmers Union's happy to be here in support of it. Thank you, Madam Chair.
Okay, thank you for your testimony. Kinza? Welcome to the committee. Please introduce yourself for the record and who you're with, and proceed with your testimony.
Madam Chair and members of the committee, my name is Kenza Haj Musa, and I'm here today on behalf of Take Action Minnesota. I'm here to share our support for House File 273 and to share the story of one Minnesota family. Rahman Ali is a leader at Take Action. He's a proud father and husband of 3. He's a proud father of 3 and a husband. He lives in Burnsville and works as a bus driver in the afternoons, which is why he can't be here today. Like many Minnesotans, healthcare is the issue that keeps Rahman and his wife, Deco, up at night. 2 of their sons have autism. Deco cares for them full-time. She also has a painful, chronic autoimmune disease that causes arthritis in her spine. Every month, she goes to the doctor to get Remicade, a prescription drug that costs $1,200 a month. Rahman makes $21 an hour and supports his whole family. Right now, Rahman and Deco are uninsured. Last year, they qualified for MinnesotaCare, and it was great. They got the care they needed, and they could afford it. But right now, they have no good options. Insuring both of them through Rahman's employer would cost $700 a month with very high deductibles. Deco would be eligible for MinnesotaCare, except that she has access to employer coverage through her husband. But what good is health insurance if you can't afford to use it? Fixing the MinnesotaCare family glitch would ensure that Deco can get the care that she needs, and this would help her whole family. Rahman said that with MinnesotaCare, Deco could sleep at night knowing she'll be able to get the treatment she needs to prevent new bone growth from fusing her vertebrae together. Our government is responsible for making healthcare work for everyone. We urge you to put families first. Rahman says thank you and God bless you. I urge you to vote yes on House File 273. Thank you.
Thank you so much for your testimony. Is there anyone else in the audience who would like to testify on House File 273? Okay, come on down, please.
Thank you, Madam Chair.
Welcome to the committee. Please
Thank you.
introduce yourself for the record, and if you're with someone in particular.
Thanks. Yeah,
Proceed.
so I thank you and the committee members for allowing me to be here. My name's Denise Robertson. I'm a MinSure certified navigator with Health Access Minnesota. We are a MinSure grantee. We serve 12 counties in southeast Minnesota, plus the metro area and beyond. My office that I work out of is actually in Rochester, Minnesota, where we serve people from both sides of the aisle. Our clients don't seem to care which party they're from. They just want help. And so we're glad you're offering this chance to help them. The concept of affordable insurance is confusing in general, which is what sort of sparks this problem to begin with. What the law defines as affordable insurance to an employee, the employee themselves might not even think is affordable, especially if they have high debt, need to pay child support, or do other things that aren't really counted in their taxable income, but which will affect their the disposable income they have. So already that concept is a bit confusing. And then when you actually add family members and say, well, the affordable factor actually only applies to the employee, not to the family members, that's simply hard for everyone to understand, partly because it doesn't make sense. If it's not affordable to one family member, it's not affordable to the family. And so right off the bat, it creates a lot of confusion for people on whether they even need to sign up for employer-sponsored insurance. In addition, we have found that some employers even tell their employees that we offer this insurance, but we know it's a high cost to you because we can't contribute to your premiums. We can only contribute to the employee premium. So why don't you go to this thing called MinSure? You go ahead and sign up through MinSure, and you'll be able to get a better deal from them. We hear people over and over telling us that their employers told them this, even though they had ESI available. So people are confused, they're getting the wrong information and not signing up for employer-sponsored coverage in the first place because they didn't realize they had to. Then what happens is they either go to the marketplace and realize they can't qualify for a tax credit or for MinnesotaCare, and then realize, oh my goodness, I not only cannot afford the premium at my employer, but I can't afford it through the marketplace either. And so now here I am with no insurance, or even worse, they might miss the open enrollment period, and then there's no option for them. They didn't sign up for ESI, they missed the open enrollment period, and now they can't apply for coverage at all until the next open enrollment period. So we're facing people that are just really confused and then facing really dire consequences, which means they either can't access it at all if they missed open enrollment, or they have no choice but something that's unaffordable. That unaffordability problem is a particular problem in southeast Minnesota, for example, where I'm from, where our premiums are very high. If you can't get a tax credit, if you don't qualify for MinnesotaCare because you have ESI offered, the premiums are very, very high and cost prohibitive. So we're seeing this a lot in southeast Minnesota, people who get excluded from MinnesotaCare because they have access to ESI. One group of spouses that I want to mention in particular who often suffer from this rule is it's in the case of people who are separated. So let's say they're separated from marriage, but not legally separated, not divorced, but not living together. And the employed spouse, often a husband, refuses to add the still wife to coverage. So now the wife can't access ESI, only has full price available, assuming they're, regardless of the income. And we see this a lot with women in the women's shelter, that kind of thing, that now they're actually 100% stuck. And even the IRS recognizes that domestic abuse often includes control over finances. We are seeing that this is one way that women who actually are victims of domestic abuse are being really negatively affected from this. And because they can't get coverage, they can't access medical services, mental health services that might help them escape the domestic violence cycle. So that is a group that we're seeing very real impact on this issue. I know it seems unlikely that this kind of result is intentional, where especially a spouse is, her income's too high to be medical assistance, so the children get to be on medical assistance, but the spouse gets nothing. I can't imagine that result was intentional, but there are certainly detrimental consequences that are leaving many spouses without coverage now. One thing I just want to point out is it would be a relatively easy fix, at least paperwork-wise. Right now, employees who have employer-sponsored coverage have to file something called an Appendix A, and on this Appendix A, it asks questions about the coverage available to the employee. Lowest cost plan available to the employee only, contribution of the employee only. All we would have to do is have another question on here for the family members to be able to establish, to be comparing apples to apples and say, oh, it's this much for the employee, it's this much for the family member, this amount for the family member is 5 times what it was for the employee. You would be able to really see that if just that question was added to Appendix A. Eliminating this family glitch, in particular the impact it has on spouses, would ensure that all family members have access to the coverage they need and that the family can, in fact, and in reality, afford. Thank you.
Thank you so much for your testimony. Is there anyone else in the audience who would like to testify on House File 273? Is there any discussion from committee? Any questions? Representative Loeffler.
Well, thank you, Madam Chair, and thank you, Representative Schultz, for bringing this forward and problem solving for a lot of our families who are caught in this. And if anyone in the audience has ideas on how we can do some more work in making family coverage affordable for small employers, I'm definitely all ears, because we used to have a system that was much more manageable for small employers. And we seem to have lost that in the process, and we need to reestablish that.
Thank you. Representative New.
Thank you, Madam Chair. And Representative Schultz, I want to make sure I just understand the mechanism, first of all. So according to I assume the Federal Code of Regulations, the Code of Federal Regulations, the employee portion can be up to 9.5% of their household income. Is that correct? I just want to make sure I understand.
Representative Schultz.
Madam Chair, I believe it's 9.86%.
Good to know.
Representative New.
Thank you. And the way this is, Madam Chair.
Representative New.
Thank you. So the way this bill is worded then on line 1.4 says, if the portion of the annual premium the employee pays for employee and dependent coverage exceeds the required contribution, then this would apply. So am I understanding correctly then that if the employee portion is at that 9.86%, then any portion, then really the spouse would automatically qualify for this additional MinnesotaCare. Is that correct?
Representative Schultz.
Thank you, Madam Chair. So if their premium from their family policy, that premium exceeds 9.86% of their household income, then they would be allowed to be eligible to enroll in MinnesotaCare, the individual.
Representative New.
Thank you, Madam Chair. So effectively, that's true. If the employee if what the employee pays for their own premium amounts to that 9.86%, then any amount of premium that the spouse would pay is too much. It would make them eligible for this buy-in.
Representative Schultz.
I believe that's correct. And maybe we want to check with House Research just to verify.
Mr. Chu.
Madam Chair, Representative New, I think the way this would work is that if the cost of, if the coverage for the employee and the dependents cost more than 9.86%, but the cost of just employee coverage was 9.86% or under, then the spouse, would not be eligible. This bill would allow the spouse to be eligible if you're adding the cost of both the employee share and the dependent coverage.
Representative New?
Thank you. So just to make sure I understand then, we are saying that if the employee portion by themselves equals that 9.86%, then any amount that the spouse would pay, it doesn't matter what that amount is, even if it's negligible, they would qualify. They would be eligible because it's above that 9.86%. They've already hit that threshold.
Mr. Chair.
Madam Chair, I think one distinction, though, is that this bill is only addressing eligibility for the spouse who would have been covered under dependent coverage. So the enrollee, assuming that the employee-only coverage, meets the affordability standard, that employee would then still be covered under the employer plan.
Yes.
Yes.
Representative.
Thank you, Madam Chair. That was my understanding. So the employee would still be eligible or required to use the employer insurance as long as they meet that 9.86%. But regardless of what the premium for the spouse is, if the employee has already hit that, they are then eligible for the MinnesotaCare.
Mr. Chu.
Madam Chair, Representative New, yes, the spouse would be eligible for MinnesotaCare.
Thank you. Thank you, Madam Chair. I felt like I wasn't sure on that answer just because I wasn't getting a yes or no. That seemed like we could get for that. Thank you.
New.
Thank you, Madam Chair. So Representative Schultz, if that is the case, then how will the premiums be determined for that spouse and dependent in MinnesotaCare?
Representative Schultz.
So, thank you, Madam Chair. So, Representative, they would be able to shop at various products, or they would be able to go on and determine their eligibility based on our current standards for the premium that they would pay through MinnesotaCare. So this allows them to be eligible to go into the MinnesotaCare system and see what they would qualify for.
Madam Chair, thank you. So that would determine their premium? They would go to the state, talk to MinnesotaCare, and MinnesotaCare would determine their premium?
Representative Schultz.
Probably. I mean, we're not creating a special eligibility system for these potentially 2,500 individuals. So right now, they're not eligible for MinnesotaCare because they have this option of their spouse's coverage. So this allows them to be eligible to buy into MinnesotaCare, to buy a product that's MinnesotaCare, that's offered by private plans.
Representative New.
Thank you, Madam Chair. But so you're unclear then on exactly how those premiums would be determined for these spouses who would now be eligible?
Representative
Madam
Schultz.
Chair, so the premium may vary based on number of children, other aspects. Yes.
Representative New.
Okay, thank you, Madam Chair. So I apologize, I don't know and maybe it was you, Representative Schultz, or one of the testifiers, mentioned that this would make for an additional 2,500 individuals eligible for the program. Do you know how this will affect reimbursement rates to the providers as compared to the current MinnesotaCare program?
Representative Schultz.
The question is, do I know how it would affect reimbursement rates to providers?
Yes.
I don't know how it would affect reimbursement rates to providers. They would be, the MinnesotaCare program establishes reimbursement rates to providers through contracts. We contract out with private health products carriers that then put together contracts with providers. So I don't see that there would be a direct impact on reimbursement rates if this becomes law.
Representative New.
Thank you, Madam Chair. Okay, so if the reimbursement rates are the same, then I'm wondering if you have had any conversations with particularly rural providers and rural hospitals on how this might affect what they're able to do. I think we know that MinnesotaCare reimbursement rates are lower than the private reimbursement rates, which puts especially a strain on our more rural hospitals. So I'm wondering if you have had any conversations with providers and those folks who would be pretty significantly impacted by this.
Representative Schultz.
Well, the alternative, thank you, Madam Chair, the alternative would be, many of these individuals would be uninsured because they couldn't afford to be covered through their spouse's plan, and they may go to a hospital in greater Minnesota or the metro area, and it would be uncompensated care. So I would believe that the hospital would prefer to have some level of coverage than no coverage for the bill. So it could benefit the hospitals by having some of their majority of their expenses paid rather than none of them paid. So it hopefully will increase coverage and pay a proportion of their hospital's costs rather than none of the hospital's costs.
I do have other members.
Can I do a follow-up to this one?
To do a follow-up.
Thank you. So to be clear, then, you have not had those discussions. We don't know how that's going to affect these rural hospitals. We haven't actually heard that from these providers.
I haven't, Madam Chair, I haven't had any concerns from those hospitals regarding this bill, and this bill was actually introduced last session, so if they had concerns, they never reached out to me with their concerns.
Thank you.
Representative Pearson.
Thank you, Madam Chair. And just the technical nature of this, it seems like there's going to be a lot of impact on who will be covered in the small group plans in the individual market. So I'm actually curious why the bill is not being referred to Commerce instead of Ways and Means.
That's a question for the chair, I believe.
And I would actually like to make that motion.
Representative Pearson, well, one of the reasons, I guess the main factor is that the chair has not requested the bill to come to them. And so it's going to move on to Ways and Means and then be directed.
Well, I'd like to make that motion that it should travel through Commerce before it goes to Ways and Means.
Okay, we have a motion on the table. Chair Liebling?
Oh, never mind, Madam Chair.
Okay, so we do have a motion before us that this bill will be re-referred to Commerce. Is that Commerce? Yes.
Can you explain why you want to do it to Commerce, Representative?
Yes. You can debate the motion. What was amending the motion?
Yeah. Okay, so what I hear is that we have a standing motion for this bill to go to Ways and Means, and we need to vote on that first, and then follow the motion for it to go to Commerce. So,
Madam Chair? Madam Chair?
Chair Liebling.
Well, thank you, Madam Chair. Well, I'm opposed to the motion, but I think the proper form of the motion would be that he's moving to amend the referral motion to send the bill to Commerce instead of Ways and Means.
You don't need to help him, you know?
Well, I'm helping the
I need
chair.
all the help I can get, don't I, Representative Liebling?
We're one big family. Come on.
Fair enough.
So the motion before the body from Representative Pearson is to have the bill be, to amend the current motion of the bill to go to Ways and Means to be re-referred to Commerce. I believe that's the motion before the body. So why don't we take a vote on that? All in favor? Is there any discussion? Representative Loeffler.
Well, thank you, Madam Chair. And since the bill is dealing with eligibility for MinnesotaCare, which is a state public program, I think it is within the jurisdiction of this committee in Health and Human Services Finance. That's different than a broad health policy that affects the entire insurance market. And so I think that the tradition has been that it's within the jurisdiction of Health and Human Services. And so I would send it to Health and Human Services Finance.
So we're going to vote on the motion. Representative Backer.
Yeah, thank you, Madam Chair. I would agree with the representative across the table there. I'm a business owner. This is going to have a tremendous impact on businesses and small businesses, a huge impact on how I would provide health insurance to my employees. So this makes complete sense to have them look at it because this is more than just health. You know, last night we listened to a clean water bill in HHS, which is the first time I've heard in 4 years, and that made sense. So this makes even more sense on how it affects businesses. So I think it's a good motion there, Representative. Thank you.
Madam Chair.
Okay, Representative Albright.
Thank you, Madam Chair. You know, I think as I look at this bill, and I certainly have some questions for the author of the bill, and while I also agree, be prepared now, I agree with the other side of the table on a travel for it, and I also agree with the motion to send it to Commerce. I also think it needs to go to Finance as well, because there is a huge fiscal note that someone should be requesting on this bill, if it hasn't been already, because we're talking about enormous subsidies for the people that enroll in this. And so while I'm sure that, you know, I probably know the outcome of the motion before us re-referring it to Commerce, I will be following up with my own motion. So I'll wait for the outcome of this one.
Okay. Representative Freiberg.
The amendment before us is for the bill to go to Ways and Means, correct?
The amendment.
I mean, if
before-
the amendment fails, that's what would happen.
Yes.
Okay. Just wanted that clear.
Okay, let's take a vote. The bill is currently going to be re-referred to Ways and Means, which I think is just perfectly fine. So the motion is to have it re-referred to Commerce. All in favor, say aye.
Aye.
All opposed? No. Those when it would not be re-referred to Commerce. Thank you. Any more discussion?
Madam Chair.
Representative Albright.
In concurrence with Representative Loeffler, and also I am sure that Representative Liebling, as the chair of the Health and Human Services Finance Committee, would make a motion and amend the motion to re-refer this to Health and Human Services Finance before it travels to Commerce. I think this is too large of a dictate to go straight to Ways and Means. I'm sure that, you know, the desire is to expedite its processing to the floor, but I don't believe that either side would prefer it go directly to Ways and Means. I think proper vetting deserves communication and conversation in finance.
So there's a motion before the body to have it referred to HHS Finance. Representative Pinto.
Thank you, Madam Chair. I guess I have a question for Representative Albright. To get to HHS Finance, the bill would have to move through Ways and Means. This is what Representative Freiberg was getting at. So I guess I'm confused about how this is any different than what we're already doing. Either way, it's going to go to Ways and Means, and the Ways and Means chair will decide where it goes. It seems pretty logical that would end up going to HHS Finance, but I guess that'd be up to the chair. So I don't quite see how this is any different than what is already happening with the bill.
So, Albright,
Thank
Representative
you
Albright.
very much, Madam Chair, and to Representative Pinto. Why does it need to stop in Ways and Means first? I understand about the divisional structure. I'm just trying to streamline the process for the benefit of a dialogue that needs to happen by moving it straight to Finance. I see no reason why it needs to go to Ways and Means first. Obviously, we're all getting used to this new divisional structure, but I'm trying to streamline it for the benefit of all who would want to hear this in committee and know what its next stop is.
Representative Pinto.
Thank you, Madam Chair. And I'll just note that bills do not get referred directly from the floor to those divisions of Ways and Means. I don't think that any bill has, so far this year, committees that have policy in the title can have bills referred directly from the floor, but otherwise, for those finance divisions, I don't think there's any bill that has been referred directly to a division of Ways and Means. The proper procedure for all the bills is to go to Ways and Means, then they get referred on.
Representative Pinto, I could probably find you a short list of where that's occurred in the past 3 weeks, and if you want to see that, I'd be happy to provide it to you.
So we're going to take the vote. There's a motion on the floor. And again, the the procedure is that a bill will leave out of this body into Ways and Means, who will direct the pathway, which will most likely go to Health and Human Service Finance. But it's the motion on the floor, and we're going to take the vote. All in favor of having House File 273 referred to Health and Human Service Finance, say aye.
Aye.
Aye. All opposed?
No.
The noes prevail. It would not travel. The motion does not prevail and would not travel to HHS Finance. So, back to the bill.
Thank you, Madam Chair. So it is my intent that this will be heard in Health and Human Services Finance, Representative Albright, and we have requested a fiscal note. This will require a 1332 waiver, so we're going to add that language onto the bill, and the fiscal note has been already requested, so by the time we get to HHS Finance, we can talk about the fiscal implications. Here, I'd like to focus on the policy, and I am open for other questions about the policy and your concerns about small employers, small businesses.
Okay, any other questions from members? Representative Albright.
Thank you, Madam Chair. A couple points that were just mentioned by the author of the bill. So you mentioned the 1332 waiver, but as I look at the bill, and I'm wanting to make sure that I don't have any negative externalities in my speech in talking about the bill, but I don't see any date of enactment on this bill. And so I'm just wondering, first off, when this would take effect based upon the language that I have in front of me.
Representative Schultz.
Yes, thank you, Madam Chair and Representative Albright. So this it depends on the 1332 waiver. So the language we will add in the next stop will be that language about enactment, dependent on the 1332 waiver being approved.
Madam Chair and Representative, so you're going to amend the bill in finance based upon an enactment date, but you're probably not going to know when that 1332 waiver is going to be approved. They do take time. So it's kind of the chicken and the egg, right? And so you're going to request the 1332, but you won't know when that 1332 waiver is going to come through. And so how can you possibly put a date of enactment? And otherwise, in other words, I probably presume you're going to say upon receipt of the 1332 enactment. I'm trying not to do your job, but is that the case?
Representative Schultz.
I thought that's what I basically said. So it will depend on the date of enactment for when the 1332 waiver, if it is received.
Madam Chair.
Albright.
So under current law for MinnesotaCare, the federal poverty guideline is about 200%. So is it true that if a person eligible for your bill would apply for whatever a medallion level of coverage, presumably their out-of-pocket cost would probably be no more than $80 a month? Is that true?
Representative Schultz.
I'm going to defer to House research on. I don't have the specifics in front of me, Representative Albright.
Madam Chair, Representative Albright, the cost for the spouse who's being covered under this bill, it would be determined on a per person basis using a sliding scale, and that's what the premium. I don't have that chart in front of me, so I can't say exactly what the amount would be, but that is available, say, on the DHS website.
Representative Albright.
Most of us understand that your ability to receive coverage would be through MinnesotaCare. So in light of, and to your point about being eligible to look and apply for coverage, why wouldn't, if we're in a dialogue about of access to coverage, and in some cases, in some places of the state, that coverage is fairly limited, why wouldn't we provide them with an opportunity to go into the private market and use the subsidies there?
Representative Schultz.
That's not how I've written the bill, Representative Albright.
Madam Chair.
Representative Albright.
Representative Schultz, I understand that's why you haven't written the bill, but would it not be appropriate to allow individuals access to the coverage of their choice and let the subsidies follow where their choice leads them, outside of possibly MinnesotaCare?
Representative Schultz.
Thank you, Madam Chair. MinnesotaCare has extensive coverage, and it's an affordable option for people in Minnesota. And I think people would be delighted to have this as a choice, given if they cannot afford coverage through their employer when it's offered.
Madam Chair, just a couple more questions. Representative Schultz, in your estimation, how many, and maybe this question's already been raised, how many people would be affected by this or be applicable to look at this favorably? How many people across the state?
Representative Schultz?
I believe I mentioned this. Thank you, Madam Chair. It's 2,400 is estimated that would be affected, but that doesn't mean they all take up the product or they enroll in MinnesotaCare.
Okay. Representative Backer?
Thank you, Madam Chair. Trying to think this through as a business owner. First of all, Representative Schultz, what would be the maximum premium a person can pay what would be the maximum premium they could pay through MinnesotaCare if they get on this? Do you have any idea?
Representative Schultz?
Thank you, Madam Chair. Representative, I will defer to House Research to see if I don't have that with me today.
Mr. John?
Madam Chair, Mr. Backer, I'm sorry, I don't have that premium chart with me either. I mean, it is available, but I don't have it with me.
Okay, thank you. Thank you, Madam Chair. What would be the maximum, let's say we're not looking at this, what's the maximum someone can pay right now in MinnesotaCare? Without, no changes whatsoever, as is right now, would you have that available? Or
Madam
would
Chair,
the...
Mr. Backer, I don't have that information either.
Okay.
Representative Backer?
Thank you, Madam Chair.
We can bring the department down to answer that question for Representative Backer.
I would appreciate that. What?
Thank you so much. Please introduce yourself for the record and what department you're with, and proceed with your testimony.
Thank you, Madam Chair. Karen Justo, Department of Human Services. I believe you're asking for the current maximum MinnesotaCare premium. It is set in statute, and it is $80 per person is the maximum premium currently.
Per month?
Per month, yes.
Okay, Representative Backer?
Yes, thank you. Then from your understanding, I'm sorry, didn't get your name, I'm sorry. What was your name again?
Karen.
Karen? Okay, thank you, Karen. From your understanding with the bill, then would that maximum change at all, or would that stay the same?
Mrs. Justo?
Thank you, Madam Chair. Representative, the bill only changes the eligibility factors related to access to affordable employer-sponsored coverage, so it would not make any changes to the MinnesotaCare premium scale.
Representative Backer?
Okay, thank you. So, and one of the two maybe can answer it. So walk me through this. So right now, I have several good staff members who are getting private insurance through our program. So if this is enacted and so forth, then walk me through the process. I mean, would myself as an employer or other small businesses under 25 people, how would this all work out then for the spouse and so forth? Because I'm not clear on how this would all then work out for the spouse, and how would they get on MinnesotaCare and stuff like that?
Mrs. Justo?
Madam Chair, Representative, I can answer that question from the perspective of an applicant. So when an applicant applies for healthcare coverage, either online through MinSure or with a paper application, we gather information about whether or not they have access to employer-sponsored coverage. We would gather additional information to understand what that premium would be for both the employee and then the family. We would apply the 9.86%, and that does index every year as required under federal law. And if an individual meets all other eligibility factors, which include income under 200% of poverty, state residency, they have to have a social security number, there's a number of other factors. If they meet those and they have access to insurance, through an employer where the employee is their spouse or they are the dependent of the employee, then if that premium were in excess of 9.86% of annual household income compared to the annual premium, then they would qualify for MinnesotaCare.
Okay. Thank you, Madam Chair. So basically, what we're also looking at is that this is only for a spouse. How about if there's a significant other living with them? This would not apply to that. Is that correct?
Mrs. Justo.
Madam Chair, Representative, correct. As written, this would apply to a spouse, correct.
Okay. Thank you, Chair. Thank you.
Representative Albright.
So to either the author of the bill or to the testifier, I just want to go back to the maximum paid is $80. So can you tell me just what are, and you can go by bronze, silver, gold, or platinum. So without any underwriting and $80, could they buy any at any one of those medallion levels of coverage, or only one?
Mrs. Justo.
Madam Chair, Representative, I think that question would be better answered perhaps by a MinSure representative. I'm not familiar with the exchange products.
Let me just talk about the subsidies then for a little bit, if I might. So what would be, so you're paying $80, but what would be the approximate value of the subsidies afforded to a person that would be paying $80 in premium per month? Do you know that?
Mrs. Justo.
Madam
Maybe that's a
Chair,
question for MinSure as well.
Representative, if you're talking about tax subsidies, yes, that would be a question for MinSure as well.
Okay, all right. Is there someone from MinSure here?
We have someone here. Thank you. Please introduce yourself for the record and who you're with, and
Hi.
proceed with your testimony.
Madam Chair, members of the committee, my name is Erica Helvig. I'm Government Affairs Manager for MinSure. However, I'm 3 weeks on the job, so I might have to get back to you on this, which is why we haven't officially met yet. But are you asking, just so I can understand, what the process is for if these spouses went on the private qualified health plans through MinSure?
Madam Chair, let me start out slow. I'll send you a softball one first, right? So how much does Minnesota spend per member on MinnesotaCare?
This is Helvet.
I'll have to get back to you on that.
Okay. So if a person has a maximum out-of-pocket cost per month of $80, what would be the subsidy that they would be provided? And is it based upon income? Because in the case of what we've heard already from Representative Schultz, if you go beyond the 9.86% to, let's say, 10%, so you're just over, and that spouse needs coverage, my understanding is that then they could secure coverage through MinnesotaCare for $80 a month. Is that true?
This is Helvet. Or
Madam Chair, Representative, I think that you're asking questions about the cost of MinnesotaCare, which would be under DHS's purview. I don't have that information, but we can certainly get that for you. If you're talking about what the state is paying out for MinnesotaCare enrollees, less their $80 or less premium.
Or less?
The maximum premium is $80.
Okay.
It's a sliding scale based on income, so we can certainly get that for you.
So Representative Albright, let me take a stab.
Okay.
This person would not be eligible for any subsidy if they enrolled on the exchange. They wouldn't be eligible to enroll in exchange product because they have employer-sponsored insurance. So, but I think you might be asking, what does the state subsidize MinnesotaCare to get these premiums down to $80 in general, regardless of anything else?
I'm looking for an aggregate amount that is spent on MinnesotaCare based upon the people that subscribe to it currently to afford people the opportunity to purchase health care insurance at $80 a month.
And I think I'm going to recommend that we have that discussion in HHS Finance when we have all the financial data and the House Research staff is prepared to talk about the financial aspect of this bill and MinnesotaCare.
I think also maybe Representative Loeffler, can you respond in any way?
Well,
to this?
thank you, Madam Chair, and we are really getting into the weeds that really are a finance issue, and we're confusing things. First of all, you have to realize that they have to be under 200% of poverty as an individual adult to qualify, which is a very low income level. So they have to meet the financial and all the other requirements that were laid out. But we also, in our purchasing of MinnesotaCare coverage, it is by age, it's by geography, how we bid out our contracts. So it would depend, it would be a different amount if it was a 21-year-old spouse as if it was a 59-year-old spouse. And it would vary based on the state. We've had an earlier hearing about how we contract, but I think these are really finance committee issues. But it's not as simple as we have one price for everybody in the state of Minnesota, no matter what their age or where they live.
Yes, and I do agree that we are getting into the weeds of the finance part of this. And so let's stay on the policy pieces of this and try to move away from all the finances and digging down into it. Representative New.
Thank you, Madam Chair. And, I'm hoping that Ms. Justo will come back. And I'm so glad that you're here. That's helpful. So I've got a couple of questions. I just want to make sure I understand. So is your understanding then that this bill, well, first, can you run through, you had mentioned them relatively quickly, the 200% of poverty level, and you said other eligibility requirements currently under MinnesotaCare. What are those current requirements?
This is Justo.
Thank you, Madam Chair. Representative, I'm going to try to remember these off the top of my head. A person must be a resident of the state of Minnesota, and those are there's federal requirements for that. A person must provide their social security number to us. They must have income at or below 200% of poverty. They must meet the insurance barriers, one of which this bill is trying to change. But if you have other health insurance, that is a barrier as well. Mm-hmm. So if you're enrolled in other health insurance or you have access to other health insurance, then you're also not eligible. I think that covers.
That's helpful. So, Madam Chair, thank you. And Ms. Justo, do you know then, I want to make sure I understand, because clearly we don't have this language in front of us. This references the Code of Federal Regulations. Is that in line with that Code of Federal Regulations, or is that Minnesota specific?
Mrs. Justo.
Thanks. Madam Chair, Representative, this code is the IRS code. It's the Internal Revenue Code. And so this test that we apply to ascertain whether someone has access to affordable employer-sponsored coverage is set out in that federal law. And we follow that as a basic health plan that receives federal dollars. We are required, absent a waiver, we are required to follow that rule.
Representative New.
Thank you, Madam Chair. And does that rule just establish the 9.8% rule, or does that establish these other eligibility requirements?
Mrs. Justo.
Madam Chair, Representative, this rule establishes the employer-sponsored coverage test.
Okay.
Representative New.
So, Madam Chair, I have some concern then with the language of this bill. The language indicates that the spouse is eligible for MinnesotaCare. So that's definitive. If the portion of the annual premium the employee pays for employee and dependent coverage exceeds the required contribution percentage. So if that percentage exceeds 9.8%, this bill language definitively qualifies them for MinnesotaCare and completely bypasses all of these other eligibility requirements. I think that is a significant concern with the language of the bill, and perhaps I'm reading that wrong. Maybe that's something that nonpartisan staff could address.
Madam Chair, Representative New, I think this could be taken in context of the overall, MinnesotaCare chapter, which would have various other sections that Ms. Justa referred to about other eligibility requirements. I mean, for one example, in paragraph A, it states that to be eligible, you must not have access to subsidized health coverage. And I think this language is probably assuming that the other requirements in the MinnesotaCare chapter are met. In other words, it's not saying each time you talk about eligibility, it's not adding, and you need to meet all of these other provisions. I think that's kind of covered in the context of the chapter.
Just create a pathway for the spouse. Representative Newt.
Thank you, Madam Chair. So do you believe then that this guarantees that we cannot bypass the additional eligibility requirements? I mean, I agree that surely the intent of the bill is to not bypass those things, but of course, we know around here, words matter. And the way I read this, it could be interpreted that way.
Madam Chair, Representative New, I mean, I think that if it's the will of the committee or the author at some point, perhaps some clarifying language should be added, or perhaps I could talk with the department and their technical assistance role, and, I guess we could decide whether or not some language would be needed.
Thank you, Madam. Thank you. And Madam Chair, I appreciate that. And Representative Schultz, I hope that you'll consider that moving forward. I assume that that's not your intent, would be to bypass those eligibility requirements. But I think that that is maybe a hole in this language. My other question is, we've talked a lot about this $80 maximum premium, but I think we've been mixing up words maybe a little bit. And perhaps, Ms. Justo, you could clarify. There's an $80 maximum premium per person. Are there potentially additional out-of-pocket costs in addition to that premium? Or is that the maximum out-of-pocket cost as well?
Representative Schultz or Mrs. Justo.
Madam Chair, Representative, yes, there is cost sharing associated with MinnesotaCare for things like prescription drugs and other medical services.
Thank you. Madam Chair.
Representative Newt.
Thank you, Madam Chair.
We have another, then we're going to pass it on to the next committee member.
Can I do a follow-up on that specifically? So is MinnesotaCare, is this a co-payment plan? Is it a co-insurance plan? How does that function currently for those out-of-pocket costs?
Mrs. Justo.
Madam Chair, Representative, I'm not sure I understand your question.
Representative Schultz.
So would it be like an 80-20 plan where MinnesotaCare pays 80% of the costs and the individual pays 20? Is it a copay where it's just a cost per visit?
We have nothing. Hi, thank you. Please introduce yourself for the record, who you're with, and proceed with your testimony.
Thank you, Madam Chair. My name is Marie Zimmerman. I'm the Assistant Commissioner of Healthcare and Medicaid Director at the Department of Human Services. Madam Chair, Representative New, so MinnesotaCare is required as a basic health plan to have a 94% actuarial value. So that means MinnesotaCare, the plan, pays for 94%, and the cost sharing for an enrollee is 6% of that cost. And right now, it's sort of a combination. It's mostly co-pays, but I want to say we have some co-insurance on some products, and my staff is nodding yes, so yes.
Okay, thank you. Thank you, Madam Chair.
Representative Pearson.
Thank you, Madam Chair. She may not want to go too far. My question kind of falls in the same category. I think if we've got somebody paying an $80 per month premium, how much is the state subsidizing that premium at that point? What is the state's costs in making that plan work at $80 per month?
Madam Chair, I believe Representative Albright asked that similar question, and we had decided to take that to finance when we had that data available.
Yep, we're getting into the finances part of this again, Representative Pearson. And we want to stay on the policy piece. We are like really digging into the finances part of this.
Madam Chair, I feel like this goes towards the policy of dismantling a plan of, private sector insurance. And the policy here is that we're turning everything into state insurance. And again, if that's the goal, which I think some people in this room don't object to, you're certainly getting us there quickly. But this is a policy discussion, and that question goes to the very nature of this discussion, mostly because if the dollar amount were high enough, maybe we should just be paying those private insurance companies that amount to get this premium down to $80 for the families. But why are we using the MinnesotaCare structure to do what the private sector could do if they could do it for less money? And I guess I would like to get to the heart of whether or not we're trying to have a policy of a government healthcare system, or if we're trying to get to the policy of having a sustainable market base for insurance in the state of Minnesota. And I think that's a legitimate policy question for this committee. And without those numbers, we really can't have a fair discussion about it.
Well, Madam
Well,
Chair.
without, Representative Pearson, those numbers is the part that needs to be vetted in Health and Human Service Finance. It is those numbers, right? And right now, we don't, that's not part of the policy pieces that this committee can take on. So we did have this discussion a little bit earlier when all the finances questions began to really inundate this committee. And we need to allow that space for Health and Human Service Finance to take place. So if we do not have any more questions
Yes, ma'am.
in relationship
Madam
to the finances
This is the
part of
policy.
the bill, we're going to
Madam Chair,
go
this-
to a vote.
Madam Chair, this is
All right,
policy.
you have the last question.
So, Representative Schultz, this bill attempts to provide health care coverage to those who cannot find access to it through private insurance through their employers. So, is your attempt to provide coverage or to reform health care?
Thank you, Madam Chair. Well, the reason I ran for office was to reform healthcare so everyone has access to affordable healthcare, and that's a longer discussion than we have time for today. But this is an attempt to help provide affordable coverage for people of Minnesota. And a lot of the funding we get, going back to the former question, is from the federal government subsidizing these types of programs through the Affordable Care Act and others, and our expansion of MinnesotaCare. Our goal this session is to identify ways in a bipartisan fashion to come up with solutions to rising healthcare costs and affordable coverage. So the goal of this bill is to start down that path of providing affordable coverage to individuals in Minnesota who may have access to employer-sponsored insurance through their spouse, but that premium is very expensive to buy family coverage. And so another alternative. We already subsidize health plans through our reinsurance program to buy down the premiums. So, I'm open to hearing some ideas about how we can get to enlarging the number of people who have access to affordable coverage.
Madam Chair, you promised me the last word, so I'll provide it. In the normal course of business, I think you would give argument to the fact that you're not reforming healthcare, and to your point, you just said it. What you're trying to do is provide healthcare to all. But at the end of the day, what we're doing is we're providing it at a highly subsidized rate. And for anyone in the room, I don't want to diminish the import of your circumstances or the plight that you face. Some are very tragic, and I certainly hear those. And I understand that it's not my intent to denigrate the desire on your heart to have health insurance and to take care of your families. But But folks, this is a means of enhancing the state's responsibility for all healthcare in this state, the government. And the government is us. And so we as elected officials are charged with the opportunity of protecting your rights to make choices on your own. I understand that there may be limited choices, but the problem is that this is not the solution that we're all looking for. This is a solution where literally we're subsidizing the cost of health care rather than addressing the cost of health care itself. If you want to take a look at the costs of health insurance and care, this is a Band-Aid on a gushing wound. And while the intent might be admirable, I think it fails to address the larger context. And if it's a leading, a leader for other issues coming down the road in weeks to come, we can certainly have that conversation, whether it be in policy or in finance or ways and means. We'll be here to have that vibrant discussion. But Representative Schultz, this is not, I really don't believe that this is going to satisfy the rigors of the health insurance providers, or more importantly, those greater Minnesota healthcare providers who are going to be obligated to take care of these folks on a lower reimbursement rate than they do in the private insurance market. So with that, I would urge members to vote no on this. Thank you.
So we have passed some.
Madam Chair. Thank you, Madam Chair. Thank you, Madam Chair.
It's new.
Given the fact that we have really, I think, had a good, thorough discussion on this, but we found some significant holds. And I'm particularly concerned about this issue of eligibility requirements, and that my reading, and there is no reference to the other eligibility requirements in this bill. It literally says they then are eligible for MinnesotaCare. And Madam Chair, I would move to table House File 273 for further work on that.
Representative New, what I heard from our House Research and Analysis is that, I didn't hear that in his response to that question. I heard more that is interpret that we are following the guidelines that is currently in statute, and just creating a process where we're adding a spouse. That's what I heard. And for that reason, for that purpose, we're going to go to a vote.
Madam Chair, is a motion to table the bill debatable?
It is not.
So I would ask for a roll call.
We can do a roll call. A roll call has been requested.
And Madam Chair, just so we clarify that the motion before the committee is to table the bill, so a vote of aye is to table the bill, and a vote of nay is to move forward with whatever referral before the body is on the bill, correct?
Yes.
Thank you.
So repeat that again.
So a green vote, my Speaker Pro Tem days. And a vote in the affirmative would table the bill to recognize the concerns that Representative New has provided. A vote of no denies the motion and moves the bill forward to whatever re-referral this division has under Ways and Means.
Okay. We're all clear. Correct. So let's go to the vote.
Chair Moran?
No.
Vice Chair Morrison? No. Minority Lead Keel?
Yes.
Representative Albright?
Yes.
Representative Backer?
Yes.
Representative Bonner?
No.
Representative Edelson?
No.
Representative Fisher?
No.
Representative Freiberg?
No.
Representative Liebling? Representative Loeffler?
No.
Representative Mann?
No.
Representative New?
Yes.
Representative Pearson.
Yes.
Representative Pinto. Representative Robbins.
Yes.
Representative Schumacher.
Yes.
Representative Schultz.
No.
So there being 7 ayes and 9 noes, the motion does not prevail. There being no further discussion, Representative Schultz renewed her motion that House File 273 be re-referred to the Committee on Ways and Means. All in favor say aye.
Aye.
All opposed?
No.
No.
The motion prevails, and House File 273 is recommended for re-referral to the Committee on Ways and Means. Thank you. So, okay. So, being that we have our next bill, which would be House File 3, Representative Liebling is not available. She's in another committee with another bill. We're going to recess until 7 p.m. this evening in room 5 here in the State Office Building. So we are recessed until then. Thank you.